UIndy's athletic training program is great because our students get an individual approach to their education.
When we think about athletic training, we have to think oftentimes beyond that high school athletic trainer, that college athletic trainer, and that pro athletic trainer. And really we need to see athletic trainers are where people are physically active.
We work with a variety of populations. We work with athletes a lot because we're very sports medicine based, but we also can work with people who are triathlon runners and people who are older or younger. When we work with pediatrics, we can work with all types of patients. So we're very diverse in our field, so we're able to work with different skill sets.
I've really always had a passion with helping people out, and I've always been fascinated with sports. I grew up an athlete, and I just wanted to stay in the field.
I wasn't as big of a I want to be out there on Friday Night Lights or on the hockey rink side of the emergency care side. I was always what things can I do from a rehab and prevention standpoint to make this person have the lowest risk of injury possible and get them back to enjoying their sports without fear of re-injury.
So you're going to see them in the military. You're going to see athletic trainers with our fire personnel and our police personnel. You're going to see them in companies and corporations. For example, just here in Indianapolis, we have the FedEx plant. We have athletic trainers there at FedEx that are on site providing care for injuries that those employees are sustaining.
Our health pavilion is an awesome place where we do a lot of collaboration, and it gives us some great spaces for our students to learn.
The biggest things you'll see are, state-of-the-art technology, things that we, use to get patients better, but then they're also going to see dedicated, collaborative healthcare workers.
It gave me an opportunity to learn, study, refine my skills in a collaborative setting with not only athletic trainers, but nurses, exercise science, occupational therapy, physical therapy. And I thought, that was the best way I could get a great education experience.
One of the most exciting things about athletic training and how it's set up and having our athletic training facility, across the street and that opportunity, is that it provides that hands-on care or reinforcement of classroom materials right away.
We also use simulations and standardized patients in our teaching. And so those two techniques really provide a safe learning environment for our students, but it mimics as close as we can true patient care.
Well, it's really hands-on, and I think that's really what athletic training is. So that gives them the opportunity to not only learn and enhance their skills, but also refine them.
Best way to really do anything in our field is very hands-on, because you can do everything by textbook in theory, but until you see it, it's never really going to be textbook. So the clinicals and the different places we've been to are super important.
It's almost like in class I'll learn one thing, and then immediately when I go to clinical, it just appears right then, and I get to practice and refine my skills in that moment.
What they're going to be doing on a day-to-day basis as an athletic trainer, they're doing in the classroom.
The student-to-faculty ratio at UIndy in our program is about 7-to-1. So that means our students get really individualized attention. We really get to know our students on a personal level. We're able to work with them on their career goals.
I really enjoy having a small class population because then all of us get to act like a family and we get to know each other.
They're fully supported throughout the entire program. They get a lot of hands-on learning. They get a lot of hands-on feedback. They get a lot of feedback even on their written assignments and things of that nature. And so it allows us to really focus and be student-centered and not to let anybody get lost in the shuffle.
The University of Indianapolis offers a lot of unique features to it. One, we're housed right here in Indianapolis, and so there are so many opportunities in our backyard that we take advantage of.
We're in this strong metropolitan area that's heavy on sports.
The hospital systems, the various different hospital systems with the pro teams, and then working with firefighters and police departments, so it's a lot of connection building out here.
When the NCAA hosts championships here, to see if our students want to have the opportunity to provide coverage with other athletic trainers under their supervision.
Large high schools and middle schools, clinical type settings, industrial type setting, pro sports, it's just all within basically the backyard of the University of Indianapolis. And being located here, you have access to all of that. I do know that we are looking at a double-digit percentage growth in athletic training within the next couple years. The statistics show at the University of Indianapolis that students do leave the University of Indianapolis and they are able to get jobs.
My hope for our graduates from our program is that they are confident, competent athletic trainers that are prepared to enter the field, but also prepared to give back to the profession.